A dry cough can be incredibly frustrating, especially when it lingers for days or even weeks without any clear reason. Unlike a wet cough, which produces mucus, a dry cough is non-productive and often leaves your throat feeling irritated or scratchy. It can sneak up on you after a cold, during allergy season, or even as a reaction to dry air. But what exactly causes it, and how can you get relief? In this video, we'll break down the common symptoms, possible causes, treatment options, and natural home remedies to help soothe that nagging cough, get you back to feeling like yourself. A dry cough is typically marked by a scratchy or tickling sensation in the throat, leading to frequent coughing without bringing up mucus. Depending on the cause, it may be accompanied by other symptoms. For instance, if the cough is due to allergies, a person might also experience sneezing, itchy eyes, or a runny nose. In cases of asthma, wheezing and shortness of breath may occur alongside the cough. When acid reflux is the culprit, symptoms like heartburn or a sour taste in the mouth may be present. Postnasal drip, another common trigger, often leads to a sensation of mucus trickling down the throat, prompting frequent throat clearing and coughing. In some cases, a dry cough can become severe enough to disrupt sleep and daily activities. Chronic dry coughing may even lead to throat soreness, hoarseness, or muscle strain in the chest. While most dry coughs are harmless and resolve on their own, persistent cases, lasting more than 3 weeks, should be evaluated by a healthcare professional to rule out serious conditions such as lung disease, heart failure, or infections like whooping cough. One of the most frequent cases of a dry cough is viral infections, such as the common cold or flu. Even after the infection clears, the airways may remain sensitive, leading to a lingering cough that can last for weeks. Upper respiratory infections, including sinusitis and pharyngitis, can also trigger a dry cough due to inflammation in the throat and nasal passages. Allergies are another major contributor. When the immune system reacts to allergens like pollen, dust, or pet dander, it releases histamines that cause nasal congestion and postnasal drip, irritating the throat and provoking a cough. Asthma, particularly cough variant asthma, often presents with a dry cough as the primary symptom, especially at night or during physical activity. Gastroesophageal reflux disease occurs when stomach acid flows back into the esophagus, irritating the lining and triggering the cough reflex. This type of cough is often worse at night or after meals. Certain medications, particularly ACE inhibitors used for high blood pressure, can also induce a dry cough as a side effect. Less common but more serious cases include COPD, lung cancer, tuberculosis, or heart failure. Environmental factors such as smoking, air pollution, or exposure to chemical irritants can also lead to chronic dry coughing. The treatment for a dry cough depends on its underlying cause. For coughs related to allergies, antihistamines or nasal corticosteroids may be prescribed to reduce inflammation and mucus production. Asthma-related coughs often require inhaled bronchodilators or corticosteroids to open the airways and reduce irritation. If acid reflux is the cause, doctors may recommend proton pump inhibitors or H2 blockers to reduce stomach acid production. Lifestyle changes such as avoiding spicy foods, eating smaller meals, and not lying down immediately after eating can also help. For persistent coughs due to bacterial infections, antibiotics may be necessary. However, viral infections do not respond to antibiotics, so treatment focuses on symptom relief. In cases where medication side effects are responsible, a doctor may adjust the dosage or switch to an alternative drug. When a dry cough is severe and disrupts sleep or daily life, cough suppressants may provide temporary relief. However, these should be used cautiously, as suppressing a cough is not always advisable, especially if mucus needs to be expelled. In addition to medical treatments, several home remedies can help soothe a dry cough. One of the most popular and effective options is honey. Known for its natural antibacterial and anti-inflammatory properties, honey can help coat the throat and reduce irritation, especially when taken by the spoonful or mixed into warm tea. Herbal teas, such as those made from ginger, peppermint, or licorice root, also work wonders. These herbs contain compounds that can ease throat discomfort, relax the airways, and reduce coughing fits. Ginger, in particular, is known for its anti-inflammatory and immune-boosting effects, making it an excellent choice when you're feeling under the weather. Staying hydrated is another essential part of managing a dry cough. Drinking plenty of water helps keep your throat moist, which can prevent further irritation. Warm fluids like broth, herbal teas, or warm lemon water are especially beneficial. Inhaling steam from a hot shower or a bowl of hot water can also ease throat dryness and loosen any hidden congestion that might be triggering your cough. For added relief, a few drops of essential oils like eucalyptus or tea tree oil can be added to the water, though this should be done with caution, especially around children or those with asthma. Controlling your environment is just as important as treating your symptoms. Using a humidifier in your room can help add moisture to the air, especially in dry climates or during winter months when indoor heating can dry out the air. This can be particularly helpful at night when coughing tends to worsen. Avoiding known irritants like cigarette smoke, dust, strong perfumes, and pet dander can also reduce coughing triggers and help your throat heal more quickly. Some people find relief by gargling with warm salt water, which can soothe inflammation and help clear out irritants from the back of the throat. Others may turn to natural supplements like slippery elm or marshmallow root, both of which are known for their demulcent properties that create a protective coating over mucous membranes. While natural remedies can be incredibly helpful, it's important to monitor your symptoms. If a dry cough lasts more than 3 weeks, it's time to consider seeing a doctor. While many dry coughs are caused by mild irritants or viral infections, a lingering or worsening cough could be a sign of something more serious like asthma, GERD, chronic bronchitis, or even a respiratory infection like pneumonia. You should also seek medical attention if your cough is accompanied by symptoms like high fever, chest pain, shortness of breath, wheezing, unexplained weight loss, or coughing up blood. These signs could indicate an underlying condition that requires professional evaluation and treatment. Additionally, if your cough disrupts your sleep or daily activities, a doctor can help identify the cause and recommend appropriate treatments to help you find relief. But as you can see, dealing with a dry cough can be both uncomfortable and exhausting. But understanding the symptoms, causes, and available remedies can make a world of difference. Many cases of dry cough are minor and can be managed with simple home treatments like honey, herbal teas, humidifiers, and steam inhalation. However, it's important to stay aware of your body and recognize when it's time to seek professional help, especially if the cough is persistent or severe. By taking early steps to soothe your throat and avoid potential irritants, you can often speed up recovery and feel better faster. Remember, a dry cough is your body's way of signaling that something needs attention, whether it's a minor irritation or a deeper health issue. Taking care of yourself, staying hydrated, and getting the right support when needed are key to restoring your comfort and getting back to normal life. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Have a nice day, and thanks for watching.